Namaste, I'm Tejaswini from Apollo Spectra, Koramangala, Bangalore. With us today we have Dr. Sampath Chandra Prasad Rao, who is an ENT and skull-based surgeon, who also is a consultant at Apollo Spectra. Today we will be talking about a very important topic, which is black fungus. So my first question to doctor is, what is black fungus and why is it an epidemic right now? Doctor?
Thank you, Tejaswini, and namaste to everybody. So, what we're dealing with today is a huge problem, and what is called black fungus is essentially Mmucormycosis. So, Mmucormycosis is a rare fungal infection that occurs in very immunocompromised individuals. And while I was training in the West for a good 7 years there, we saw very few cases of Mmucormycosis, and in fact, an incidence of 2 to 3 cases over a short period of time would have been probably investigated as a probable epidemic. In India today, we've scored about 10,000 cases, and most of them in the last few months, and that's been the problem. A huge surge in the number of cases in a very short period of a few months has been a cause of serious concern, and we in the medical fraternity are quite perplexed, and I would say a little astonished at the sudden increase in the number of cases. So mucormycosis or black fungus comes from a species of fungal elements called Mmucormycosis, and this is a ubiquitous fungal infection which is present everywhere. When I say ubiquitous, that means that this is an organism that is present all over the place, everywhere, predominantly in soil and in saprophytic elements, that is plant sources and other vegetative areas. Now, these fungal elements produce spores, and these spores are in the air, and as we speak there are spores everywhere. So fungal infections per se are as old as the history of organisms on the planet, and they are some of the oldest organisms on the planet. They are around us and they will remain around us. These are not new organisms like, for instance, the COVID-19 virus. The COVID-19 virus is a new virus which is being spread in the environment as we speak, but the spores of an organism like mucor has been there, has always been there, and will be there. Now, the reason why an infection occurs is when some of these spores make an entry into the human body. Thankfully, we as normal human beings are quite immune, and our immune system is well equipped to deal with fungal infections. And fungal infections are, even if they're rare, they can be quite fatal. They can be quite troublesome because they are hard to get past by, when compared to, let's say, a bacterial infection or a viral infection. So, again, thankfully, the body defense mechanisms are well maintained and well equipped to ward off most fungal infections. But what we're seeing today is a very worrisome rise in the number of cases. To put things in perspective, India had an annual incidence of just about 100 cases, and even if you were to exaggerate those numbers a little, the baseline number of cases in India would probably not be more than 150 cases before COVID. But what we are seeing now is a 100-fold increase in the number of cases, and if this continues over a period of a whole year, we are looking at an annual incidence of close to 30 to 40,000 cases, which is way above an annual incidence of 100 cases before the first COVID wave, I would say. So this huge spurt in the number of cases is what is the reason why we are all alarmed, and it's really a cause for concern.